Regulations. Let's talk about them. The Center for Medicare and Medicaid Services has made their final rule for 2024. We're going to mainly focus on how this affects agents and agencies, not necessarily how it affects carriers and things like that. So really how it's going to affect you in your day-to-day job. So the first one, and there are a lot of them, this is going to take a while to get through, and I don't agree with a lot of them, and I'll go over why as we do this. So the first one prohibits the use of the Medicare name or the CMS or Health and Human Services logo to be used by agents or agencies. This I don't necessarily have a problem with. I mean, it says unless describing a product, so we can say Medicare Advantage, I guess, or we offer Medicare products. Again, there's not a lot of guidance yet. These things literally just came out. They also took into account, or not really took into account, but there was over 400 comments made on this public document, and they really didn't take any of those things into account. They just made it final, and they're going to look at it in the future to possibly adjust it. So, tells you what they think of what you're saying about their rules. Okay, so although we do have a tagline on our cards that say Medicare Insurance Simplified. It's the tagline that we use to let people know that we offer Medicare type products. We have to get some clarification on whether or not we can still use that on our website or anywhere. There also is a modification of the third-party marketing organization disclaimer. Now, this came about in 2022 for the 2023 year that we all had to read a disclaimer and that we were all considered third-party marketing organizations. So an agent, a lead generator that you're using, anybody that's not the plan themselves, that's trying to get enrollments into the plan. So there were some regulations that came out that we had to say this disclaimer in the first 60 seconds of a call and in all electronic communications as well. They're going to add to this disclaimer. Right now, it's directing people to go to 1-800-MEDICARE or Medicare.gov, which I think is ridiculous. As a salesperson that's telling somebody to go to the government to get what they need, it's kind of like if you sold cars and the state competed against you and wanted to every time someone came in to buy a car, tell them you should go over there to buy one. That's really what it is. They're going to modify it to make you put the total number of products available to that beneficiary that you offer. What does that mean? We're still unclear. Is that this is the number of products and the number of carriers and products for you individually that I offer in your county? Is it total? Is it the state? If we're just talking about Part D plans, do we just tell them how many Part D carriers and companies we represent in plans? So there's a lot of confusion about exactly what we have to do with this. I'm thinking that it's just a total. So if I personally represent 30 different carriers with 300 different plans, then I think that's what I'd say. Also, there's hierarchies to these things. You know, a lot of us have field marketing organizations or agencies that we're a part of. So are we disclaiming what the agency is contracted with and the number of products they represent, or just the individual agent? Is it both? When we're sending an email from ourselves, do we have to put our individual stuff? And when the agency sends a newsletter, do they have to put how many products they represent? So I think this is going to cause more confusion than it's going to clear things up, which a lot of these regulations do. They're going to again state that you cannot use superlatives, the things like best or the lowest costing, without showing proof. And this has always been. I guess they're getting more complaints about this, and this is why they're reiterating this fact. But yeah, you're never allowed to say this is the best product or this is better. That we don't use those words because it potentially isn't. We say it can be best suited for your needs or the product that fits or matches your individual needs, but we can't use the word best. That is an opinion. Okay. We're also going to get a new thing that's going to be hard to figure out as well, which prohibits marketing to beneficiaries plans where they're not available, unless it's part of a national ad campaign. I don't know where this doesn't come from a national ad campaign. So this rule that they've created, I don't know how they're going to implement it. What they're really trying to do here is, there's a lot of times when national carriers will have, good plans perhaps in the state, and then they talk about those benefits in a statewide ad campaign. This leads to confusion, having beneficiaries call in for a plan that's not available in their area. So, well, again, like, a lot of these companies that do this are the national ad companies. So they're going to continue to do this. And it's very hard to target as an agency if we're targeting people in this specific county. Usually we do it with generic stuff saying, hey, we're an agency. We offer a lot of plans in your area. Please give us a call. Now we kind of have to put inside of there exactly which plan it is, not as to cause confusion. But that doesn't really work for us as brokers because, again, we represent a number of different plans. There are even meetings where we filed for the same company at the same meeting. So we're doing a multi-plan meeting. So again, we're just a little bit unclear on how this is going to work. They're going to require us as well, this is a follow-up to that, if we're marketing something, to put a plan name on it. So again, it's just a little bit confusing. As agencies, as agents that help people, and we're selling ourselves as a service, we just need clarification on what we can do now. They're also going to prohibit the marketing of general savings. And this is really aimed at, again, those national ad and call center places that are messing things up for everyone. And what they're saying is that they've been using ads in the past that said, if you didn't have Medicare compared to somebody that didn't have any insurance, you could save $6,000 with this plan. That's not necessarily true. If a person already had a plan in place that had a maximum and was possibly even lower than that, they may not be saving anything. I think this is a good provision. They're going to make it harder for those people to kind of trick people into giving them a call for plans and savings that aren't really available. They are going to make updates to the permission to contact and SOA requirements. Now, a permission to contact form is something that we collect usually when we're doing an informal or formal meeting. We collect a permission to give that person a call, talk about insurance, and possibly set up an appointment for them to do an in-home. A scope of appointment is something that you do before that appointment. It defines the scope of what the appointment's going to be about. Basically, these people have agreed to speak about these types of products. This is incredibly weird, and it happens in no other industry besides ours. They let you buy a house without doing an SOA. They let you buy a car. They let you buy life insurance without doing a scope of appointment. This is really something that they implemented that, and I actually don't know of any insurance agent that's been in trouble for one of these either. So that's something to think about. But it used to be that when the first requirement came out for a scope of appointments, they had to be done 48 hours prior to an in-person meeting. They removed that restriction because there was no complaints about scope of appointments. They have now reinstituted this. So what this means is if you have a permission to call and you reach out to a client and they want to talk about insurance, you can't. You have to tell them, I have to wait 48 hours to talk with you. How does this make sense? Do we honestly think that seniors aren't smart enough to understand what they're talking about? You're going to let them buy a house and do a reverse mortgage, but you can't buy health insurance without a 48-hour waiting period? It doesn't really help the client. Of course, we're going to abide by all of these regulations, and we're going to... Now, they did put a provision in there. They did say if it's backed up against the end of an enrollment period, so let's say that there's only 1 day left in the enrollment period for that month and that person needs to get on, then you can do it beforehand. And I'm pretty sure, again, we need clarification on this too, they made it for walk-ins too. So if you have an office and somebody walks in, well, to me, if someone calls me, contacts me, then that's the same thing as them walking into my office. So if they want to talk about insurance, we can do an SOA, or should be able to do an SOA right then and talk about insurance. And if this is not true, then every call center out there is done. They'll have to call a person back 48 hours later, and that won't ever work. So I believe, and everything I'm saying is just my general thoughts about this because, again, these just came out. We'll get some more clarification later. But I believe that if they call you and you take an SOA, you can talk about product right then. Okay. They are also going to kind of back off a little bit on the Medicare call recording requirements. It was stated before in 2023 that we all had to record every call that related to the chain of enrollment. That basically means every call. Now, they're just doing it for marketing, sales, and enrollment calls. So they don't have to record the appointment or they don't have to record the call that sets up the appointment. That's kind of weird. We're still going to record every single one of our calls. But one of the provisions in this thing that didn't go through was that third-party marketing organizations could not share data between each other, meaning if you use a lead company or an advertising agency, they couldn't share data with you or give you the lead, virtually making them obsolete. They kind of backed off of that as well. But what is a marketing call? What is a sales call? What is an enrollment call? To me, before, the chain of enrollment helped me define that by saying, okay, anything that's talking about new product or potentially going to go into a new product needs to be recorded. So we're going to continue to record everything, but they're saying that for certain things, so you only have to do it for marketing, sales, and enrollment calls. And to clarify that if you're using a virtual platform like Zoom or Google Meet or anything like that, that those must be recorded as well. Not the full video presentation, but the audio has to be recorded. This is one of the most cumbersome things that our agents went through last year. We had to set up a new system in our current system, charge more money for it because it's incredibly cumbersome to set up to make sure that all of their calls were recorded. I think this kind of alleviates some of that fear because they're looking at it and saying, we just want the enrollment portion to make sure that you're going over all the things in the pre-enrollment, post-enrollment checklist, going over all the plan benefits and all that good stuff. So I'm kind of okay with that. Okay. Oh, they're also going to limit the business reply cards to 12 months. Before, you could use them whenever. The business reply cards are going to be limited to 12 full months, and they're going to clarify the prohibition on door-to-door contact. There are agents out there that will get a permission to contact card and think that that means that they can go and knock on that person's door. That's not right. Unless you have an appointment set up with that person, you cannot go and knock on their door. It is an illegal practice. There are a couple of new elements as well that are required on the enrollment forms. There are going to be a couple things added to the pre-enrollment checklist that you have to go over with the client. Specifically, what's going to happen to their other plan once they enroll. All of these provisions come out because of complaints that the Center for Medicare and Medicaid Services gets. Of all of the enrollments, can you guess the percentage of complaints that the Center for Medicare and Medicaid Services gets? It is less than 1%. Less than 1% of people complain about their enrollment, yet we get all of these. Okay. They're also going to revise educational and sale event rules. What they're saying is that if you're at an educational event, we used to be able to pass out scope of appointment forms if somebody wanted to set up an appointment to talk about their individual needs afterwards. Now we can't do that. So what you're saying is you're at an educational meeting with a client, you're explaining to them the basic tenets of Medicare, and they say, you know what, Joe, I'd love to have a private conversation with you about my personal needs. I have to say no. I have to say, the only thing we can do now is get a permission to contact form. So I'd say, okay, you can fill out this permission to contact, and then I can call you after you leave this meeting, and then we can set up an appointment and do an electronic SOA because I couldn't do it at the meeting. That really doesn't make any sense to me whatsoever. I get what they're trying to do here. What they're trying to do here is they're trying to separate education meetings and sales meetings. There was a provision that you couldn't hold one directly after a sales meeting, directly after a educational meeting. That provision went away, and now it's going to come back, where you cannot hold them directly after the educational meeting. We don't do this. And I get it. You have to try to mitigate all these people that do this, but it's a very low percentage of people that even present in person. And most of us have ethics, and we're compliant when we do this. So I don't think that it's I don't think it's incredibly restrictive to the sense that we won't do Medicare education meetings anymore. We will always continue to do those. It's what shows that we're the expert to the community. And even afterwards, a lot of times I just get phone calls. So we will continue to do them. It just, for people that were on the bubble, they're not going to do them anymore. So that really gets the education of Medicare recipients to be less and less. Is this really what we're striving for? As agents, we need to review and ensure that we're compliant with all these policies, but we do not need to agree with them, right? We need to do them, and we're going to. We're going to implement everything that they ask us to do. But realistically, when we look at this as an overall whole, we can see what's happening. There is some interest and money in not having field agents anymore. And I'll show you why. Okay? Now, a commission is usually paid when an insurance policy is sold. The highest level of commission goes to a field agent. It's called a fair market value commission. If, for instance, somebody calls into a carrier and says, I'd like to just enroll over the phone, well, there's a much smaller commission paid to that phone agent and a much smaller salary. If they call Medicare themselves, 1-800-MEDICARE, or go online to the carrier's website or to Medicare.gov, where they're telling us to refer them to, then a commission is not paid. A perpetuity is not paid. So again, I give the example. It's like, let's say you sell cars, and you have a bunch of different dealerships that are selling cars. You have the manufacturer that's selling cars direct, so they're your competition. Now imagine the state sold cars, and their interest and the owner of the car, the manufacturer of the car, was to not pay more in commission every time something is sold. Well, they would push everything to the state, right, where there's no commission being given. So that's what's happening. They're attempting to push things to Medicare.gov, 1-800-MEDICARE, online enrollment, and carrier direct enrollment. Why is that bad for you as the client? Well, you're no longer going to get unbiased opinions. If you call the carrier direct, they can only sell you their product, and they're going to continue to talk to you about that and nothing else. How does that help you? Right? How does that show you everything available if you can only talk to one carrier? So now the onus is going to be on you to do that. If you call 1-800-MEDICARE or go to Medicare.gov, yeah, you can see the information there. It's incredibly difficult to understand. And I'd like to give you an experiment to do for yourself. Pick up your phone right now. Call 1-800-MEDICARE. Ask a simple question that you already know the answer to. Get your answer, hang up, and do it 5 more times. I'm fairly certain that you'll get at least 4 different answers. Imagine you work for Medicare and you're in a call center. It's national. You get calls from everywhere at all times. How many plans do you have to know about? Thousands. Are you going to be well-versed and understand the nuances of each of those? Are you going to understand the networks and areas where people are calling from? No. You're going to do the bare minimum to get the person enrolled in a plan and off the phone. And when there's a complaint that comes about Medicare to Medicare, we don't hear about those. Right? So they can try to do whatever they'd like to get us out of the industry and make this worse for consumers. But we're going to be here. We're going to fight back against these regulations. We're going to, of course, adhere to every single one of them that sticks on the books. But we want to make sure that you get the most information, the easiest way to compare that information, and to have a professional that just does this help you. Because if they take all of the money and commission out of this industry, then you're going to have very poor people in this industry, right? So we want a fair environment where everyone is treated on an equal playing field, and where the people that actually sit down with clients, that go into their homes, that care about them, that get the call that grandma has to do cancer treatment and actually feel for that person, we want to be the ones that can provide you with this information. So I really hope that they look at all of those comments and they take those into consideration, because realistically, the people that are making these regulations have no idea what the hell it means to be a field service agent or field agent that sells Medicare insurance. They really don't. Thank you very much for listening. Please follow us on all of our channels for more information and tips on how to sell Medicare insurance and make yourself the best possible agent that you can be in the Medicare space. Once again, I'm Joe Valenzuela for Vista Mutual Insurance Services. Follow us for more information.